Can nerve damage regenerate? Your doctor told you nerves don't heal. That's a lie. And I can prove it with something your own doctor uses. By the end of this video, you'll understand why the nerves don't heal or don't regenerate myth is keeping you trapped, and what's actually happening in your body right now that proves your nerves can heal. Look, I know you've been told to just manage symptoms and that your neuropathy is permanent. That advice is just wrong. It's dangerous. Because when you believe your nerves are dead, you stop looking for real solutions. You accept a life of pain, numbness, medications, and watching your world just get smaller. But here's the truth. Over the past 10 years, I've watched thousands of neuropathy patients get better. Not because we did something miraculous, but because we treated nerves like what they actually are, living tissue that wants to heal. I'm going to show you research you can verify for yourself on PubMed, and I'm going to walk you through an example from conventional medicine itself that accidentally proves nerve regeneration. This isn't fringe science, this is basic biology that somehow gets left out at the conversation when you're sitting in a neurologist's office being told there's nothing you can do. Let's start with the lie you've been probably told, that nerve damage is permanent. Now, a lot of people are told, oh, you can't heal a damaged nerve. Well, that's just not true. This false belief is the #1 reason neuropathy patients give up and resign themselves to symptom management. And picture this. You leave the doctor's office, you've been told it's permanent, so you stop searching. You accept the medications, you start planning your life around limitations instead of healing. When you believe healing is impossible, you stop doing the things that actually could help your nerves recover. That's not medical advice, that's a death sentence for hope. But here's what they're not telling you. The science. Nerves are plastic. Here's what the research actually shows about nerve regeneration. 100% nerve can regenerate on their own. It's slow, right? In ideal conditions, you're looking at about 1 millimeter per day, maybe 2. You can find peer-reviewed studies on PubMed right now showing nerve regeneration rates and neuroplasticity. This isn't controversial, in neuroscience. It's only controversial in the treatment room when there's no profitable protocol for it. Our nerves are plastic. They are trying to find ways to regrow, to reconnect. Let me break down what plastic means. Your nervous system is constantly adapting, rewiring, rebuilding. It's not a static system. It's dynamic and very responsive. Every single day, your body is trying to repair damage, form new connections, restore function. Now, here's an important distinction. You can't heal a dead nerve. When a nerve has been severed, traumatized, and it's dead, no, you can't heal that. But that's not what most neuropathy patients are dealing with. Most neuropathy is damaged nerves, not dead nerves. And damaged nerves absolutely can heal when you create the right conditions. So if nerves regenerate, why doesn't your doctor talk about it? Well, let me show you proof they already know this. There's a therapy out there that people use for pain called nerve ablations. This is where they literally cauterize a nerve or freeze it or block it to stop pain signals. For some, that's a pretty extreme measure just to treat pain, and not one I recommend. But here's the kicker. It's not a permanent thing. When people get these done, the relief wears off. And you know why it wears off? Because the body grew a new nerve.
Let that sink in.
Let that sink in for just a moment. When the block wears off, the cauterization or the freezing wears off, it wears off because the body grew a new nerve. So when people say nerves don't heal, it's just not true. And this is proof from conventional medicine itself. If nerves couldn't regenerate, neuroablations would be permanent, but they're not. Every pain management doctor knows this. They're literally banking on your body's ability to regenerate nerve tissue. They just frame it as a problem, keep coming back itself instead. They're literally banking on your body's ability to regenerate nerve tissue. They just frame it as the problem coming back instead of your body healing itself. So if your body can regrow a nerve tissue, a nerve, after it's been literally burned or frozen, why aren't you being told your neuropathy can't heal? Here's the real reason you haven't gotten better yet. It's just kind of breaking those false beliefs that people have been told with neuropathy. There's nothing you can do. Your nerves won't grow back. Well, they do. We've been doing this for over 10 years, and we see it happen every single day. It's why our patients get better, because we're addressing the root cause of the issue and not just focusing on the symptoms. Let me paint the contrast clearly. The conventional approach, gabapentin for pain. Topical creams for numbness, learn to live with it. The root cause approach, we ask, why are your nerves damaged in the first place? Poor circulation, metabolic dysfunction, inflammation, compression. Address that, and the nerves heal themselves. Your body already wants to heal. It's trying to regenerate those nerves right now. Our job is to remove the obstacles and create the conditions where that natural healing can happen. You're not broken. Your body isn't failing you. You've just been treating the wrong thing. Now, I can't dive into specific treatment protocols in this video. Every case is different, and I need to understand what's actually causing your nerve damage. But if you're in the Quad City area or you want to explore a virtual neuropathy program, we offer consultations, new patient exams where we'll go through your full history, run the right tests, and build a clear plan tailored to your situation. No guessing, no generic advice, just a doctor-led roadmap based on what's actually happening in your body. Link is in the description. So what does all this mean for your neuropathy? If you're watching this and you've been living with neuropathy, accepting that it's permanent, that your life is just going to keep shrinking, I need you to hear this. That's not true. Your nerves are all alive. They're plastic. They're trying to heal right now. The question isn't, can they heal? It's, are you creating the conditions for healing, or are you just managing symptoms? I know you tried things that didn't work. I know you've been let down, but now you need to understand why those approaches failed. They were treating the symptom, not the cause. We've worked with thousands of neuropathy patients over the last decade, people who were told exactly what you were told, and they got better. Not because we have magic, but because we work with the body's natural ability to heal. So, if you're ready to stop managing symptoms and start addressing root causes, here's what you need to know. Let's recap. Nerves absolutely can regenerate. The research proves it. Nerve ablations prove it. We see it clinically every single day. The nerves don't heal myth isn't science, it's medical fatalism. And when you understand that your nerves are plastic, that they're trying to heal right now, everything changes. You stop accepting symptom management and start demanding root cause treatment. But here's the next question. If your nerves can heal, why doesn't everyone with neuropathy get better? What's stopping your nerves from regenerating the way they should? Now that you understand nerve regeneration is real, you need to know what's blocking it in your body. In my next video, I'll show you exactly what to look for and how to know which one is keeping you stuck.